Okay, so we're going to move on to congenital circulation and blood vessel disorders. Um, some of these we've talked about during the heart when we talk about the cardiac system, but some of them are truly considered, vascular, like vessel issues. So let's talk a little bit about atrial septal defect. We already know that atrial septal defect is that there's a hole, the foramen ovale, between your atria when you're born, and it's supposed to close within a year, but sometimes it doesn't, and it can cause problems with your blood to flow in a proper manner. You shouldn't have deoxygenated blood going into your um, left ventricle. And depending on how big it is, it can make you cyanotic. So babies, it's normally, you notice it because their skin and their mucous membranes get blue, especially when they're crying, because that's like an extra activity, because there isn't enough oxygen in the blood. And they can just go in and patch that. Atrioventricular septal defects, those are an opening between the atria and ventricles and valves between the atria and ventricles. So there's a problem with the septum between the atria and the ventricles, and there's also a problem with the valves. Or there may be a problem with the valves as well. So they close it using a patch, and if there's a problem with the valves, they have to replace the valves. Ventricular septal defect is something else that we talked about. It's an opening in the septum separating ventricles and closed using a patch. And again, this can be a very dangerous one because blood from the right side of the heart is now flowing into the left side of the heart. And depending on how big that is, you have a direct squeeze, a strong squeeze to the wrong side of the heart. And that absolutely has to be closed using a patch. So here's one, tricuspid atresia, and that is when the tricuspid valve between the right atria and the right ventricle fails to develop. So the blood, what they do is they shunt the blood from the right atria directly to the pulmonary artery. And this puts the blood in, because it can't get into the ventricle, right? So it pushes the blood into that pulmonary artery to get to the lungs, and then it comes around again. And they have to go in and try to put in a tricuspid. So they'll use this shunt until the baby's about 2 or 3, and then they'll go in and try to fix it. The last one we have here, there's vascular malformations. So these are atriovenous malformations. And I did put a picture here, and it involves the arteries, the veins, the capillaries, the lymph vessels. And what happens is they form these little clumps, okay? And depending on how severe it is, depends on what they're going to do. So my sister had an AV malformation on the top of her head when she was born, and it was there for a long time. And the doctor was like, don't worry about it. It'll go away. And it eventually did. However, some people have these in their brain, in their all over their vascular system. And I did have a patient who, I think I talked to you guys about this once. He was having an endoscopy, colonoscopy, to be more specific. And when the doctor pushed the air in to open up the bowel, one of the AV malformations broke, and the air went right into his vascular system, and he died. It was really, really unexpected, and they can be dangerous. The last one is not in your book, but I think it's a really important one. It's called transposition of the great vessels. This is fatal. Okay, so they do try to figure this out. If there's something, early on, try to get that child into surgery if they can. But it's when the aorta is attached to the right ventricle and the pulmonary artery is attached to the left ventricle. So there's no oxygenated blood going into the body through the aorta. And also the oxygenated blood is going to the lungs where it doesn't need to oxygenate. So this is a lethal problem. And if there's other like the atrial, the foramen ovale, what will happen is it'll stay open. The body kind of fights back and it stays open. And because of that, the blood is going from one side of the heart to the other, and it's enough oxygen to keep that child alive till they can fix this. Um, let's see what else we got here. All right. I'm going to stop there, and I will do these in the next video. Okay.